These are the things to remember and steps to perform cardiopulmonary resuscitation. Please remember that you must stay calm and composed whenever you will perform a CPR because the more you panic, the more you will perform the CPR wrong, and it might cause to a bigger problem. Call an emergency hotline or call for emergency response that is near in your area. Then lay the person on their back and check for their ABCs, which are the airway, the breathing, and circulation. Using 2 fingers, check the pulse near the ear of the patient. If the patient is not breathing and not responding when you check their ABCs, you must perform CPR. Remember that we have different hand positions depending on our patient. First, for the adults, our hands must be open and the other hand will be above the other hand and interlock the fingers before placing it in the chest of the patient. Also, the patient must be on your hip area, and by performing it, you must extend your arms and your arms are the only one moving while giving CPR. Next hand position are for child. If the child is our patient, we must use one hand and the heel of that hand are the one who will give chest pumps. Third and last hand positions are for the infant patients. If we have infant patients, we must use only 2 fingers and that are the one who will pump in the chest of the patient. After knowing the basic information about CPR, we can now start executing it. Remember to stay calm and composed if you will execute CPR. Then call an emergency hotline for emergency response. Then lay the patient on their back and check for their airway, breathing, circulation, or the ABCs. And if the patient is not breathing or not responding, perform the CPR. In performing CPRs, we will give the patient with 30 compressions with counting 1001, 1002, 1003, and so on, until the patient will respond. If the patient is still not responding after 30 compression, give them 2 rescue breath. And to give rescue breath, remember to open the airways by lifting the chin slightly and pinching the patient's nose and give them 2 rescue breath. If the patient still not respond, continue to give 30 compressions and 2 rescue breath. If in worst case and the patient are still not responding and you have a car or a vehicle with you, go to the nearest hospital and rush the patient to the emergency room so that they will give the first aid and will have a professional to give the proper medicine and medications or actions for the patient.